Understanding tuberculosis, causes, symptoms, and treatment. Tuberculosis, TB, is a contagious infectious disease caused by the bacteria Mycobacterium tuberculosis. It primarily affects the lungs, but can also target other parts of the body such as the brain, spine, or kidneys. Understanding the causes, symptoms, and treatment of tuberculosis is crucial for preventing its spread and managing the condition effectively. Causes of tuberculosis. Tuberculosis is primarily spread through the air when an infected individual coughs, sneezes, or speaks. The bacteria are released into the air and can be inhaled by others nearby. However, not everyone who inhales the bacteria will develop active tuberculosis. Some factors that increase the risk of developing the disease include weakened immune system, malnutrition, substance abuse, close contact with an infected individual, living in crowded or unsanitary conditions, being from a country with a high prevalence of tuberculosis. Symptoms of tuberculosis. The symptoms of tuberculosis can vary depending on the location of the infection within the body. In pulmonary tuberculosis, which affects the lungs, common symptoms include coughing that lasts for more than 3 weeks, chest pain, coughing up blood or mucus, fatigue, fever, night sweats, loss of appetite, unintended weight loss. Extrapulmonary tuberculosis, which affects areas outside the lungs, may produce symptoms specific to the affected area. For example, tuberculosis in the spine, called Pott's disease, may cause back pain and spinal deformities, while tuberculosis in the kidneys may result in blood in the urine and urinary tract infections. Treatment of tuberculosis. Early diagnosis and proper treatment are essential for managing tuberculosis effectively. The treatment typically involves taking multiple antibiotics for a period of 6 to 9 months. The most common medications used to treat tuberculosis are isoniazid, rifampin, ethambutol, and pyrazinamide. These antibiotics work together to kill the bacteria and prevent their resistance to the drugs. In addition to medication, individuals with tuberculosis may need to make certain lifestyle changes to support their recovery. A healthy diet plays a significant role in boosting the immune system and speeding up the healing process. Including specific foods in their diet can aid in the treatment of tuberculosis. Diet and foods to aid in treating tuberculosis. While proper medical treatment is indispensable, incorporating nutritious foods into the diet can complement the efforts to fight tuberculosis. Here are some food items that can aid in the treatment of tuberculosis. 1. High-protein foods. Consuming foods rich in protein is essential for repairing tissues and supporting the immune system. Good sources of protein include lean meats, poultry, fish, eggs, dairy products, legumes, and nuts. Adding these protein-rich foods to meals can provide the body with the necessary nutrients to fight off the infection. 2. Fruits and vegetables. Colorful fruits and vegetables are packed with essential vitamins, minerals, and antioxidants that help strengthen the immune system. Incorporating a variety of fruits and vegetables such as berries, citrus fruits, leafy greens, carrots, and bell peppers can provide the body with the necessary nutrients to combat tuberculosis. 3. Whole grains. Whole grains like brown rice, quinoa, whole wheat bread, and oats are rich in fiber, vitamins, and minerals. They provide sustained energy and can aid in maintaining a healthy weight. Including whole grains in the diet can support overall health and help in the recovery process. 4. Healthy fats. Consuming healthy fats like avocados, nuts, and olive oil can provide the body with essential fatty acids and aid in the absorption of certain vitamins. Including these healthy fats in meals can promote better overall health and support the body's healing process. 5. Probiotic-rich foods. Probiotics, found in foods like yogurt, kefir, sauerkraut, and kimchi, can help maintain a healthy gut microbiome. A healthy gut is crucial for proper digestion and nutrient absorption, which plays a role in supporting the immune system. Conclusion. Understanding tuberculosis, its causes, symptoms, and treatment is vital for the prevention and management of this contagious disease. While medical treatment is crucial, adopting a healthy diet that includes high-protein foods, fruits, vegetables, whole grains, healthy fats, and probiotic-rich foods can aid in supporting the immune system and promoting recovery. Consult a healthcare professional for personalized advice and treatment options.